Hi, my name's Rich. I'm from the Student Wellbeing team at Leeds Beckett University, and I'm a school-based wellbeing practitioner, and I'll explain what that means in a minute. So I want to share the work that we've been doing because it's something I'm really excited about, and it was something that the University Mental Health Charter assessors were particularly interested in and described as sector-leading in our assessment, so it may be of value to others. So I want to talk about bridging the gap between university professional services and academic teams, and also about moving upstream, so not focusing only on those students who are experiencing poor mental well-being downstream, but also considering methods for improving the well-being of the whole student community, not just those who are asking for support. So I'm going to give you a quick overview of my role. I'm going to zoom in and talk about the psychoeducational aspect of the work, and then I'm going to finish by sharing some attempts at evaluating the impact of these sessions. So like many student wellbeing teams in HEIs, we employ accredited counsellors and registered mental health practitioners and specialist mentors. But what I'm going to focus on is the school-based wellbeing practitioners. So we're all registered professionals with extensive clinical experience, which is important in terms of clinical governance and managing risk. And we're each aligned to one or two academic schools. Our work focuses on positively influencing the cultures of the academic schools we work with and highlighting the relevance of wellbeing in higher education. So there are three strands to the role. We provide our school colleagues with advice and guidance on student-specific issues. We also get involved in providing support coordination for a small number of students with more complex needs, which might be a barrier to them engaging with the support of our central wellbeing team. But the part of the role I'm going to focus on is the third point on the slide, which is all about psychoeducation. So the aim of the school-based team is to work towards improving the well-being of all students and by taking a proactive, preventative approach. And so for this reason, all of the sessions are module embedded and timetabled at a relevant point in the student's academic journey. Running generic sessions that are open to all students hasn't worked. No one attends. And those few who do attend are not the students who most need to be there. Importantly, these sessions are co-designed and co-delivered with our academic colleagues. We are what Whitchurch has termed third space practitioners, so collaborating with academics and bridging the gap between professional services and the academic schools, aiming to create something which looks like the diagram on the right. In terms of what this looks like on a day-to-day basis, I typically spend 4 out of 5 days per week with my academic colleagues, so I'm essentially part of two teams. And what we've discovered is that relationship is everything. If they don't know us, none of the work happens. They don't approach us for advice, and they certainly don't invite us into the classroom. Every session we deliver is tailored to the subject and level of study, making them difficult to compare, but there are a few common themes. So we highlight the bidirectional relationship between well-being and academic performance, the ways in which improving well-being improves academic success, and vice versa. We nod to the evidence base informing the model on the previous slide. It's important for students and academics to know that we're not just making this stuff up. Our sessions involve the facilitation of a discussion on the common stresses experienced by students, but our focus really is on their coping skills, on their resources, the taps on the stress bucket. We adopt a salutogenic approach, so focusing on health-promoting activities rather than mental health difficulties, so we eschew a deficit model. We ask students to share the activities they practice to maintain their well-being with each other, so it's a form of peer education. And what we found is the knowledge is usually already in the room. I guess if you want to think about it theoretically, we're applying Knowles's ideas about andragogy, about adult education. Our learners have pre-existing knowledge based on their lived experience that we can use, not only to engage, but also to empower them. To use the language of Ryan and Deasy, if we can help our students to feel competent, to give them opportunities for autonomy, and create an environment which fosters a sense of relatedness or belonging, then their motivation and their well-being is going to improve. I think it's also important to move beyond the neoliberal narrative of individual responsibility for health, encouraging students to think critically about the wider social determinants of health, and the structural inequities which are linked to their sense of well-being or lack thereof. So it's quite a health promotion approach that we use. Although sessions will vary in content and focus, all will contain some form of practical exercise, in this case a breathing exercise, or some sort of noticing or grounding technique. So students don't just need knowledge around maintaining or improving their well-being, they need skills. And that's why I think it's important to actually practice this stuff, to try it out in the classroom. Improving well-being is not just about seeking professional support when things get tough. that might be a part of it. But like I mentioned at the beginning, that's a downstream response. And I think we need to be looking further upstream for interventions which can benefit all of our students, not waiting until the wheels have come off and they're really struggling. So that's the core of what we do in a nutshell, but the focus will always be on a subject-specific issue. So for example, I work with the School of Health, and we do some preparation for placement sessions with our professional registration courses. For example, physiotherapy, nursing, occupational therapy, social work. I also do a population health and wellbeing session with the level 6 nursing students. A colleague does a working as a criminologist session with our criminology students, thinking about how to maintain your wellbeing when you're dealing with quite difficult subject matter. Also sessions on boosting creativity and managing uncertainty with our art students, and also managing a healthy film set with the film students, all about healthy communication, boundaries and well-being. Another session a colleague runs called Meeting the Challenge, which run for our business apprentices. And Keeping on Track is another session run with our sports students. This is just a selection of the sessions we do. What I would say is, yes, co-creating these sessions with our academic colleagues takes more time and effort than just churning out a series of generic wellbeing sessions. But I think it's definitely worth that time and effort, because what we end up with is something that is tailored to the subject those students or apprentices have chosen to study. And our academic colleagues can help us translate our wellbeing message into the language of the field they're studying and are going to be working in once they're qualified. And this information needs to feel relevant, otherwise it's just not going to have any impact. We've had a go at evaluating the impact of these sessions, attempting to measure change between the beginning and the end of these sessions. So we ask students to rate their agreement or disagreement with 3 statements on a Likert scale. So here are the figures for the last academic year. So on average, by the end of our sessions, there's been a 10% increase in the number of students who strongly agree with the first statement. I believe that looking after my well-being has a positive impact on my learning. And more significantly, we've recorded a 34% increase in the number of students who strongly agree with the statements, I am aware of strategies to look after my well-being, and I plan to use strategies to look after my well-being. In terms of qualitative feedback, we ask students 2 questions with a free text box to answer. What did you find most useful? And is there anything that would improve the session? So for the first question, the answers all appear to fall within 3 main categories. The vast majority of answers to this question mention some form of somatic technique, some sort of felt experience, usually a breathing exercise, a progressive muscle relaxation, maybe a mindfulness exercise. The second theme is around learning from each other and through group discussion, realizing they're not the only ones who feel the way they do, reducing a sense of isolation and developing a sense of belonging to the group. And then the third big theme is around increased awareness of well-being promoting activities. To the question, is there anything that would improve the session? The comments all seem to be around practical things, the location, sometimes the environment, the room, the physical environment that we're working in. For example, group work or discussion is quite difficult in large lecture theatres. Sometimes students have mentioned the timing of the session within the semester, and we've made some changes around that. So sometimes they felt, if we're talking to them in level 6, towards the end of their time with us, the feedback has often been, why didn't you tell us about this stuff earlier? And so, changes have been made to think about when we talk about this stuff with our students. Okay, I'm going to stop talking there. I hope that's been of interest, and thank you so much for listening.